Hi, my name is Kaylee, and I'm going to present to you my project on dissociative identity disorder, or DID. So DID, previously known as multiple personality disorder, is the presence of two or more distinct personality traits or identities within one individual, which helps people work through and put traumatic experiences into perspective. These identities can have their own way of thinking, feeling, and behaving, but this leads to memory gaps and impaired functioning. So the DSM-5 criterion for DID includes two or more distinct personality states, an experience of possession, marked discontinuity in sense of self and sense of agency, related alterations in affect, behavior, consciousness, memory, perception, cognition, and or sensory motor functioning, recurrent gaps in recall inconsistent with ordinary forgetting, clinically significant distress or impairment in important areas of functioning, and this disturbance is not part of a normal or broadly accepted cultural or religious practice. So trauma is a key factor in DID development. The most common cause of this trauma is repeated physical or sexual abuse during early childhood, but there are other forms of emotional abuse, neglect, or unpredictable family environments that also play a role. Some physical effects of DID include headaches, chronic pain, lightheadedness, sleep disturbances such as insomnia, night terrors, and sleepwalking, and seizures that are not related to epilepsy. Some cognitive effects of DID include memory loss that's more severe than usual forgetfulness and has no medical explanation, disruptions in concentration and executive functioning, fragmented identity, as we can see in the alters, and derealization, which is feeling as though the world is distorted or not real. DID can also cause a person to be able to speak different languages and adopt different speech patterns, new vocabulary, or even speak in a different tone of voice. As for social and emotional development, DID can cause a person to struggle to maintain consistent relationships due to the sudden and unexpected shifts in mood and identity states, and it also makes it extremely difficult to manage emotions related to past trauma or conflict within the system of identities. The presence of different identities in DID can also lead to variations in moral perspectives and beliefs within the same individual, and this can result in internal conflicts or confusion about personal values, ethical decision-making, and self-perception. In terms of personality development, people with DID can often displace aspects of their experiences onto other parts of themselves, even after the traumatic situation has passed. This can include having a main personality that might be passive, dependent, and depressed, and alternative personalities, or alters, that may be different ages and genders, and have different moods and preferences. These alter egos take turns being in control, and when one personality is not in control, it dissociates or detaches and may even be unaware of what is truly happening. DID affects 1.5% of the global population, although estimates vary widely, and it might be more common because it is often underreported. Additionally, DID affects women 9 times more than men, and typically presents between the ages of 5 and 10. So as stated before, trauma plays a major role in the development of DID. 90% of people with DID in the US, Canada, and Europe have experienced childhood abuse and neglect, and the remaining 10% have experienced other types of trauma in childhood, such as medical trauma, natural disasters, or war. So when you have DID, it's also very common to experience other mental health disorders. For example, according to one study, 67.14% of people with DID also have depressive disorder, 30% had conversion disorder, 20% had anxiety disorder, 11.42% had personality disorder, 5.71% had substance abuse disorder, and 1.42% had PTSD. So the most common treatment for DID is psychotherapy, which is basically when you're talking to some type of mental health care provider about your mental health. So in this process, you will process traumatic experience, manage symptoms, and improve coping skills. And you can also do dialectal behavior therapy, which helps people learn to manage their emotions, cope with difficulties, and improve relationships with others. So although there are no medicines that specifically treat dissociative disorders, your doctor may prescribe antidepressants, anti-anxiety, or antipsychotic meds, or mood stabilizers. So educational programs are also extremely effective. This includes psychoeducation, skill-building workshops, and trauma-informed care, which can improve understanding and support for individuals with DID and other trauma-related conditions. Participating in support groups or pre-led programs specifically for individuals with DID can also provide a sense of validation, connection, and understanding, and it can also offer opportunities for sharing experiences, learning from others, and receiving support and encouragement. Involving family members or significant others in therapy might also be beneficial for improving communication, addressing relational issues, and creating a supportive environment for the person with DID. Some symptoms in children that are not typically present in adults include imaginary friends, nightmares and sleep disturbances, impaired school performance, and role confusion across different contexts, such as home, school, and social settings. And finally, the purpose of the research study that I found was to debunk 6 common myths about DID, because if you don't really understand the true facts about DID, clinicians can't carefully assess for it, and they will misdiagnose it, and then it can't be resolved. So the first myth that I found was that DID is a fad that will die, but this is obviously not true because there's such an expanding body of research that negates this myth, because if it was fake, scientists would not be putting so much effort into this research. There's also a false theory that DID is misdiagnosed, especially in North America, but as seen in the table, the disease is clearly legitimate because it's also diagnosed in Switzerland, Turkey, the Netherlands, Germany, Israel, and many other countries. So the third myth that I found is that DID is rare, but although that 1.5% of the population does seem like a very low percentage of people with DID, because it is so misunderstood and hard to detect, there could be many people walking around that have DID and just don't know it. The fourth myth that I found is that DID is not a trauma-based disorder, but it's iatrogenic, meaning it's caused by medical activity like diagnosis, intervention, error, or negligence, and it happens in fantasy-prone individuals. But DID there's no study in any clinical population that supports the fantasy model of dissociation. For example, a single study conducted in a normal sample of college students showed that people can engage in identity enactments when asked to behave as if they had DID, but did not actually begin to believe that they had it, and they did not develop symptoms. So that basically shows that it's not a fantasy, it's legitimate. So the fifth myth that I found is that DID is the same disorder as borderline personality disorder, because on the surface, BPD and DID appear to have similar psychological profiles and symptoms, but one of the difficulties in differentiating the two disorders has been the poor definition of the dissociation criterion of BPD and the DSM's various editions. So the theory is that once this DSM-5 description has been revised, there will be less confusion. So the final myth that I found is that DID treatment is harmful to patients, but according to the research article that I found, these claims are baseless and lack empirical support. Therefore, there's no true reason to believe that it's harmful, and we can assume that it's completely safe.